Good morning, Chair. Good morning, Commissioners, ex officios, and staff. My name is Tony Hughes. I'm a Special Agent Supervisor with the Regulation Unit with the Gambling Commission. One of my roles with the Gambling Commission is Project Manager. We're working with multiple staff members on the Self-Exclusion Project. My role started back in October of 21 when we knew the rules, when we were going to be starting with it. There we go. It does work. Just a quick summary of the Self-Exclusion Program. The program began in May 1st of 2022. At this time, we have over 500 people participating in the Self-Exclusion Program. The Regulation Unit within the Gambling Commission is doing compliance inspections at all the house bank card rooms. I'll talk about that a little bit in future slides, but we recently did, in the first quarter of this year, completed compliance inspections at the card rooms. In May and June of 2023, I went out to all the card rooms, visited each one personally, and that was kind of an outreach from kind of conversations that happened at the March Commission meeting. So in May and June, I visited all the card rooms. All the card rooms already had the self-exclusion forms, but I did deliver the hard copies of all the available languages of the enrollment forms and the healthcare authorities RAC card, problem gambling information. So those all hand delivered at that point. Available languages, just there are the self-exclusion enrollment forms. There are 12 versions of that, one being English, and the healthcare authorities RAC card. There's 8. Working with the healthcare authority right now to get those, so they're the same number. It's just a process of working with another state agency, and Roxanne and I have been in conversation about that. During that outreach, I did walk through every card room through the website and where to access all the information on the website for enrollment forms, all the different available languages, the RAC cards. So we had that conversation. I also had a conversation with them about their enrollment process, just basically have them walk me through when somebody comes in and wants to enroll, what they do. And then we also had a conversation about language barriers. Based on the feedback I received from the card rooms, they've been able to overcome the language barriers using staff members and family members to translate. One exception was one specific card room had a population that spoke Hindi, and so they reached out to the agency about adding that language. And it took us about 3 to 4 weeks to get our forms translated and posted on the website. And when I met with them one-on-one, they were very appreciative of the turnaround time, and that's helped them. Since the beginning of the program, we've added 4 languages, and if and when I reached out to the card rooms, if there's an additional language they need, to reach out, and we'll work quickly. It's taken about 3 to 4 weeks to get it translated and posted on our website. During that outreach, I did just talked about just the difference in the state self-exclusion program, kind of some changes. Change slide. There we go. How the self-exclusion program, the state self-exclusion program, is different to their self-barring programs they had before. Specifically, I talked about 230-23020, that the self-exclusion program, or if somebody applies and is in the program, that exclusion applies across to all house bank card rooms. The enrollment period cannot be altered or rescinded, and funds will be confiscated. So it's just a conversation, is when they're assisting somebody about when somebody enrolls, they understand what they're enrolling into. I also took that opportunity to give feedback to the house bank card rooms from our administrator that receives those enrollment forms, just to let them know when they do submit those applications, make sure they're complete, that the photo is of good quality. And this also gave them a heads up, there are common names on the self-exclusion list now. There's been a couple of instances where somebody went into a card room, they were told they were on the self-exclusion list, where they were not. They need to check date of birth. So the list is growing, and so there's some common names now. Also had the opportunity to have a conversation with them about how the impact of the self-exclusion program has been to the house bank card rooms, and I'll talk about that more in the measurables. Also gave them an opportunity to give us feedback about how it's been going. Overall, the feedback from the card rooms was positive. They said the introduction and how it's been operating was positive. I think not only the house bank card rooms, I think us as staff was surprised how quickly the list grew. And And so far, the list and how we've been managing that has been user friendly, and there's been positive feedback there. There we go. If I get behind the slides, let me know. Give me a thumbs up. Gambling Commission staff has been responsive to requests and have made the transition into this program easier. So that's kind of the outreach I did in May and June. The next few slides are I'm going to start going into the measurables. Any questions on? I guess I don't see any. I'll just keep chugging unless I get questions as I go. On the measurables, so this is based on 14 months of information. This is from May 1st, 2022 to June 30, 2023. So that's 14 months of information. We have 571 participants in the program. As a refresher, there are 4 options for time periods to select: 1 year, 1, 3, 5, and 10 years. We've had 186 persons select 1, 95 3, 60 people in 5 years, and 230 in 10. How many participants are eligible to come off the list in the upcoming year? Again, we're 14 months into it, so we have 31 participants eligible to come off the list, and that those are persons that enrolled last May and June and selected 1-year terms. 101 more participants are eligible to come off the list before the end of the year. And then the next slide talks about those 31. Out of the 31 persons eligible to come off the list, 7 participants have removed themselves from the list, and they do that by submitting a form to the Gambling Commission, a form that we created, and we just verify that the term they selected has expired. And then 24 participants are still on the list. Moving on. How many participants attempted to enter card rooms or were caught at house bank card rooms? We've had 123 incidents reported to agents that we've looked into. Examples of how excluded persons were caught. They were caught at the door by security officers using scanners. There are card rooms. Some card rooms are using scanners to scan IDs when people enter, and that is attached to the self-exclusion list. They've been recognized at the bar, restaurant, gambling at tables, attempting to get paid jackpot prizes, and attempting to get cash advances at the cage. How many times have funds been confiscated? We've had 49 incidents where funds have been confiscated from persons on the self-exclusion list. Total funds confiscated during that time period is $44,301.50, and those funds were forwarded to the Healthcare Authority. And generally, those funds have been confiscated at the cage when participants attempt to cash out.
I have a question, Madam Chair. Quick question for the staff to research for me. I'd like to know, I want to be reassured that those funds being sent to HCA are going to the program at HCA for prevention of problem gambling, as opposed to just being put into the entire account for HCA. I want to make sure they're being earmarked for prevention or for treatment. Thank you. If someone could get back to me, unless you know the answer right now, but if you can get back.
I think yeah, Roxanne and I from the Healthcare Authority have been in contact. We have verified those funds have made it to their problem gambling account at the Healthcare Authority. If
okay.
That's what you're asking.
That's it. Thank you.
Yeah.
Tony, maybe you can explain how we've worked with Healthcare Authorities to ensure that transmitters are, directing those funds accordingly.
Part of the training initially when the program started and during the outreach as well, or as card rooms had to confiscate funds, we've had to let them know about there's a specific form card rooms need to use when they send confiscated funds to the Healthcare Authority. So that makes sure it gets earmarked by the Healthcare Authority, it gets deposited in the correct account. Myself and Tina have been in communication with Roxanne, and she's provided us spreadsheets and basically we've compared from the confiscation that I'm aware of on our side, we compared to what the funds have been received, and those numbers match. Does that answer your question, Commissioner?
That was great, more than adequately. Thank you.
All right, thank you. And we'll have constant communication as well. Moving forward, again, we will be doing, the regulatory unit will be doing ongoing compliance inspections specific to self-exclusion. In the first quarter of this year, we completed inspections at all the house bank card rooms. During those inspections, we verify compliance with training, enrolling persons, monitoring, preventing participants, and confidentiality. Agents work with those card rooms to gain compliance, and the annual compliance inspections will be a part of our ongoing compliance program. Based on those inspections, the card rooms have done well with a new program. I provided some examples of some of the items that were noted during those inspections. They were not widespread. They're just more specific to card rooms. I just want to give you kind of examples, some of the things we noted during those inspections, but it is not widespread. The self-exclusion list was not updated and provided this house bank card room staff within 48 hours. The healthcare authority rack card wasn't available at the time of inspection. IC violations were not all required staff that based on their ICs were supposed to have access to the list did. Training, not all new hires trained within 3 days, and some staff had limited knowledge of the program. Player tracking, if they did have player tracking, we do verify that their points were zeroed out. And then if they did confiscate funds, that information is retained for 1 year. So those are some of the examples we noticed during inspections. Number of enrollment forms denied or incomplete, 14. So these are enrollment forms that are received by the Gambling Commission, our administrator, and for different reasons they were not processed. The person was not entered. Some of the examples of why: the form was not notarized, the participant failed to complete or sign the form, the house bank card room did not complete their portion of the form, or the photo is of poor quality. When we do receive those, our administrator does follow up with the person trying to enroll and trying to make that complete, just to honor their request. Currently, we have 14 that are, at least 14 that have not been completed, but the administrator we do make attempts to complete those. How many participants have attempted to remove themselves from the program? The number is 6. This is different. So these are persons that their enrollment period did not yet expire, so they're not eligible to come off the list. So we've had 6 people contact the agency trying to remove themselves from the list. Reasons why they wanted to remove themselves is they didn't understand what they were signing up for. They believe that self-exclusion was only applicable to the card room where they enrolled, a language barrier, or simply they didn't want to be on the list anymore. How participants enrolled in the program. So there are 4 ways to enroll into the self-exclusion program. You can go to any house bank card room. They will assist you with enrolling. You can go to the Gambling Commission office and we will help you enroll as well. Or you can print off an enrollment form, fill it out, have it notarized and mail it to the Gambling Commission, or you can also have it signed by a prong gambling counselor. And this is a breakdown of those 571 enrollments. 86% or 489 were enrolled at a house bank card room. 9% or 54 were enrolled, mailed in their enrollment with a notary. 4% or 25 came to the Gambling Commission office to enroll themselves, and 1% or 3 enrolled them, sent in an enrollment form with the prong gambling counselor. Okay, updates on online enrollment. We will have an online enrollment feature at some point. Once we complete our IT modernization, we're required to have that within 6 months of IT modernization. Not available yet. And then tribal participation, there's no changes this time. Currently, just the house bank card rooms. Currently, no tribes are participating in the state self-exclusion program. And then feedback I received from card rooms as I did my outreach. So this is feedback I received on the impact of the self-exclusion program. It's more specific to the first bullet is predominantly from the I-5 corridor house bank card rooms. they believe they've received a monetary loss to the card rooms. From what I heard, excluded persons are still gambling. They're just gambling at travel casinos. One card room that has multiple locations had laid off employees, and they believe self-exclusion played a role in that layoff. The next bullet, emotional decision to self-exclude and regret it. There's a recommendation or recommendations from card rooms that a cooling off period would be recommended. The way the rules are set up now, once somebody submits their enrollment form with either with the Gambling Commission or with a house bank card room, once they receive it, they are considered enrolled, so they can't change that or rescind it. So that recommended a cooling off period. Other feedback was it's easy to join the program, but difficult to get removed. And then the last one was this is coming from more smaller communities that have a card room that's in the side of bowling center. So you have a bowling center that has bowling, amusement center, restaurant, bar, and also a card room. They would like to see the rules amended where the exclusion is only applicable to the card room portion of their business, not the whole facility. That was more, that feedback was more from the smaller communities. And that is my presentation. Questions?
Representative Kloba? Oh, wait, I think that's Commissioner Patterson.
Yeah, Commissioner.
All right.
Representative Kloba can go first if she wants to.
So she didn't actually have her hand up. Bud misled me.
Well, Representative Kloba, I'm really interested in your thoughts on what I'm going to say, as well as my colleagues on the Gambling Commission. We just attended the National Council of Legislators from Gambling States conference in Denver and learned how comprehensive self-exclusion programs are in many other states, where every facility in the state is involved in self-exclusion. And it made me think about how clear it is that if you have a tremendous addiction and you are self-excluded from the Silver Dollar Casino, it's clear to me that you're going to get in your car and you're going to drive over to the Muckleshoots. And we don't have any ability to really do anything about that. You know, I think over 70% of gambling in the state of Washington takes place in Indian facilities. And so it's great that people can self-exclude from our house bank card rooms, but there's a big, massive hole in our program because of the fact that so much gambling takes place on tribal property. And I don't know if Rebecca is there today or anyone representing the tribes there today, but I just wonder what is the best way for us to begin to seriously work with our tribes to make this self-exclusion effort statewide, so that our state can be like many of the other states that are doing this comprehensively. How in the world do we begin to make that happen?
Well, if I can respond.
Yes, I'd love to hear your opinion on that.
Well, I mean, number one, I'm very pleased to see the amount of enrollment. It seems as though this is a tool that is working for people, so I appreciate that. I think some of the, it's easier to get on the list than get off. That's actually best practice. So the fact that that's been observed, I think is a positive, actually. And I want to make sure that we all understand that the tribal casinos all have their own self-exclusion programs. And I think we can continue to have a conversation with them about, is there a way to link it? I think it's also good to remember that they not only have self-exclusion programs, but they also, many of them offer treatment, which is something that card rooms don't do. So I think that there's certainly some pros and cons to not having a complete statewide one system, but we I don't want us to lose sight of the fact that there are very good responsible gaming and problem gambling programs that the tribes do offer. This notion of some sort of bleed over into the I-5 corridor tribal gaming facilities, again, it's a tool that an individual can use. And so they have the opportunity, I think, in every case, in every tribal casino, to do that same process of self-exclusion. So it is up to the individual with the gambling addiction. I think the other thing to remember is that lottery and horse racing also have they participate in the same program. I haven't yet gotten a report from either of those, but this conversation reminds me that I should look into that and see what their stats are looking like. And then finally, I think I'd like to dig a little deeper into that notion about having to lay off because of self-exclusion. Number one, it's 560 people over the entire state. That seems like a small amount of the hundreds and thousands of people who do gamble, and so it would seem to be a drop in the bucket, insignificant from a card room perspective, very significant for each individual and their ability. And I also think, and this is going to be a value judgment, I think that I know that the tribal casinos have said this, and I would assume that the house bank card rooms feel the same way, that they've no interest in profiting on people's diagnosed disease. And so that may or may not be the fact that that's why they've had to lay off. But I think in my mind, that also has a positive side to it, that they're no longer profiting off of someone's diagnosed mental health disease.
Can I follow up, Madam Chair?
Yeah.
Thanks very much, Representative Kloba. The thing about the tribal self-exclusion, I'm not clear, but I don't think that you can go into the Muckleshoots, for instance, and self-exclude across all tribal casinos.
No,
And so
you can't.
it's the same ridiculous scenario where you expect someone with an addiction who wants, in that moment of clarity, to prevent themselves from doing this destructive thing. They would have to go from tribal casino to tribal casino to tribal casino, to get it done. And that's the beauty of your legislation, is that someone can walk into one house bank card room and exclude themselves from all statewide. That's what I'd like to see us work with. The tribes have made it very clear, of course, that they consider this to be very important and they take it very seriously. But I would love to see the tribes coordinate that activity so that someone could walk into one tribe and self-exclude from all tribal casinos. I mean, that would be a huge step forward. So that's something that we can't do, obviously, but it's something that we could express our desire for them to do and to ask them if they would be willing to work on that, I think. That's my opinion.
Sure. Of course, we can always express desires. I also think that one of the things that Special Agent was talking about was that there will be, at some point in time, once our IT modernization project is finished, an opportunity for this to go digital. I think that to the extent that we might be able to sort of build a better mousetrap, if you will, that could potentially be an incentive for tribes to participate in the program. If it turned out that it were easy, very simple, less effort on their part, for instance, it behooves us to make something that is something that they would like to participate in. So I think we can continue on with those efforts.
Thank you. Thanks for the conversation. Thank you, Madam Chair. I hope someday that we do have a complete statewide self-exclusion program. Thank you.
Thank you. Senator Conway, do you have your hand up?
Yeah, I have a question for staff. Do we know where the 571 self-exclusions are? Are they largely in the I-5 corridor, or are they statewide? Do you monitor where the self-exclusion is going on? I guess that's the first question I have.
The answer is no. We have not been tracking that. I mean, we have all the enrollment forms. I mean, it's something that could be done, but I mean, I don't have the statistics in front of me, but I'm fairly certain it's I-5 corridor is a large percentage of it.
Right. It would be interesting to know that, because one of the issues that the tribes have shared with me that is somewhat of a barrier to their participation is the statewide, that if it were more regionally based, some of the self-exclusion, that it might be more attractive to tribal. I say that because the tribes the casinos are regional. They're not all located in the I-5 corridor, and that maybe we need to have an ability to statewide self-exclusion is a great idea. I'm not trying to say that it isn't a great idea, but it's obvious to me that gambling is a regional opportunity too, and that it may be that we need to try and figure out ways to develop methodology around regional self-exclusion. But I'll just leave it at that. It would be interesting to me to, the card rooms are a limited number, so it's been a great opportunity to work with the card rooms on this because there's not as many, and that maybe we could make this more effective if we are trying to develop some kind of a regional approach to it as well. So thank you.
Yes.
So not to disagree with you, Senator, that would, in my reading of RCW 946-071 subsection 1D, to me, I believe that would require a legislative change, because it says, therefore, the Washington State Gambling Commission must establish a statewide self-exclusion program. Just something to consider for the future.
Any other comments on this? Any public comment? All right, well, thank you. That was very interesting.
Well done.
Yeah.